If you could know that one day you would develop the symptoms of a hereditary disease, would you want to know? A genetic counselor and genetic testing are there to help.
Genetic counseling is a process that involves interviewing a patient, and in most cases, the patient is the entire family. We try to help diagnose different conditions that may have a hereditary component so that we can allow the patients to be able to get the proper services, know what works and what doesn't work, so they can understand what's the natural course of the condition.
Genetic testing can be done for a variety of reasons, such as diagnosing a disorder, predicting genetic risk for developing a medical issue, or determining if you carry a gene for a medical concern. McCann's job is to give the patient enough information to make an informed decision.
I'm not really there to tell them that they need to test or not to test. If you decide you're not ready, I'm going to say, okay, just let's think about it a little bit. You're welcome to come back and touch bases with me. Let's make sure that you're sure this is something you want to do.
If you undergo genetic testing, McCann is there to help explain the results.
I can help you understand what the test results mean and maybe give you a little bit of relief, take away some of your fear.
A genetic counselor might also talk about non-medical concerns.
Talk about things like how are your finances going to be impacted? How long are you going to be able to work? When do you tell the people at work?
McCann counsels people prior to testing for prenatal, neurological, and certain connective tissue disorders. Other common hereditary concerns that can be screened for are cancer, Alzheimer's disease, inherited clotting problems, and many more. With this Essentia Health Medical Insight, I'm Tracy Briggs.